All right, so today we are going to be wrapping up some of the concepts for chapter 1. So between today and tomorrow, we are going to be doing that. And right now we're going to talk about the anatomical planes. So these are essentially planes that can be cut through the human body in order to view the location and relative position of different internal organs. Okay, so first we have the transverse, which is essentially, if you're standing up, it would be a horizontal plane through your body. So the transverse plane divides the body into an upper and a lower portion. Frontal or coronal will run through the body from one side to the other, okay, as you can see here. So it will divide the body into a front and a back portion. And then the sagittal, which can also be called mid-sagittal if it is perfectly in the middle here, will essentially go right through from front to back in order to divide the body into left and right portions. Okay, so again, these planes are used to, as terms for a cut or a division into the body to look at the internal organs. Okay, so the sagittal plane, like I said, helps to divide the body into left and right sections. Mid-sagittal is directly in the middle, so it would, be symmetrical, dividing the left and the right perfectly in half. The transverse plane is a cross-section cut. Okay, so the horizontal plane dividing into top and bottom. So taking the whole length of the human body and just at one spot, just making a cross section, okay, division horizontally through it. Okay, so dividing into top and bottom halves. Well, not halves, but sections. And then the coronal plane divides the body into front and back sections. Okay. Relative positions, I will tell you now, are very important, and I place a lot of emphasis on the relative positions. These and the anatomical positions are going to be very important for you for this entire year. So if you're going to learn anything from this chapter, it should be this as well as the anatomical positions. Okay, so these terms are used to describe the location of one thing in relation to the position of another thing. Okay, so if we're talking about one structure and I want you to tell me where it is, you can use these terms while referring to something else to tell me where it is. So the ones that we have here: anterior, posterior, ventral is another term for anterior, and dorsal is another term for posterior. Okay, so anterior / ventral or posterior / dorsal. Anterior just means that something is in front, and posterior means that something is in back. So you can see this person is in anatomical position. So anatomical position is somebody standing up, slightly, their heels slightly raised, their palms facing forward, but body standing erect. So in this position, something that is anterior is going to be in front, and something that is posterior is going to be behind. Okay, superior and inferior. Something that is superior is going to be located above. Okay, so again, in anatomical position, something will be above. So something, example of this would be the head is superior to the torso. And inferior is the opposite, it's going to be below. Okay, so the legs are inferior to the torso. All right, next we have medial and lateral. So medial is going to be closer to the midsection, okay, to that mid-sagittal line, and lateral is going to be farther away. So the example I can use here is the heart is medial to the lungs. Okay, your heart is located in the center of your chest. The lungs are located lateral to them, to your heart. Okay, so the heart is medial to the lungs. Okay, or we can say the lungs are lateral to the heart. Proximal and distal are terms that are used to refer to the limbs typically, and the location of something relative to how close it is to the trunk here, essentially how close it is to the shoulder or to the hip. So proximal is going to be closer to the torso, whereas distal is going to be farther away. So I could say the elbow is proximal to the fingers, okay, or down here, I can say the foot is distal to the knee. Okay, superficial and deep. This is not a very good diagram. It's kind of hard to make a diagram of superficial and deep, but superficial just means that it is closer to the body's surface, and deep means that it is essentially deeper in, so it's farther away from the body's surface. So you could say the skin is superficial to the muscles, okay, or you can say the heart is deep to the sternum. So the sternum is the bone that you have right here in the center of your chest. Okay, so the heart would be deeper than that. All right, so definitely need to know these. We're gonna have a bunch of practice with this, so be prepared for that. Next, we got the body cavities. So here we have the dorsal cavity, should be 1S. This diagram is, it works, but you know, the spelling mistake here. So dorsal with 1S. So we have the cranial cavity, which houses the brain, the spinal cavity that houses the spinal cord. Okay, so the dorsal cavity is composed of both of these, but you know, then we have two parts of it. Okay, so the spinal cavity holds the spinal cord, cranial cavity holds the brain. Okay, then we get into the ventral cavity. So again, ventral meaning front, dorsal meaning back. You can see that towards the front of this person's body, that the ventral cavity is in front of the dorsal cavity. So the thoracic cavity is up in the chest. That's where you'll find the lungs and the heart. Then down here, the abdominal cavity and the pelvic cavity. So, or you can call it the abdominopelvic cavity, because there really is no division here. It's just that the pelvic cavity just kind of sits more within the pelvis. Okay, so this is where we'll find all of the digestive organs, and down here, the urinary bladder. Okay, but the stomach, the liver, the intestines, okay, are all found within the abdominal pelvic cavity. So the division here between the thoracic and the abdominal cavity is the diaphragm. Okay, so there is no division here, which is why it can be called the abdominopelvic cavity, because there really is no barrier between the abdominal and the pelvic cavities. Okay, so the very last thing that we are going to cover today involve the regions within the abdominal region. So these can be divided up into either quadrants or, you know, essentially like here, a tic-tac-toe board, as I like to say. So if you've ever been to the doctor with any sort of abdominal pain and you've looked at their notes, they'll mention something, they'll use one of these terms because these help to localize what it is that you are feeling. Okay, so if they know that you have pain up here in your left hypochondriac region, then that could mean that you have, you know, an issue with perhaps your ribs here, or it could be likely that it's your pancreas. So basically things that are here, you know, doctors know what could be causing the pain that you're experiencing in the left hypochondriac region. Okay, so that this helps them to narrow down what it could possibly be. Okay, so with the quadrants, we have the left upper, left lower, right upper, right lower. But if you notice that we're looking at this diagram, this doesn't really make sense because right is on the right, left is on, right is on the left, left is on the right. Okay, but you got to remember, we're looking at this relative to this person, not your left and right. Okay, so this is this person's left and this person's right. So keep that in mind whenever we're looking at these diagrams. We're looking at the front of them. So the left is going to be over here and the right is going to be over here. Okay, and then over here, we've got the left hypochondriac, right hypochondriac, which just means below connective tissue. Okay, the epigastric region, okay, is going to be largely where you find the stomach. Then as we move down, we have the left lumbar, right lumbar, so your lower back is located here. So left lumbar, right lumbar, umbilical region, which is where you find your belly button. And then down here, which is more towards your, you know, pelvis region, groin, you have the left iliac and the right iliac, which these names come from your hip bone, which is called a coxa. Okay, so left iliac, right iliac, and then hypogastric region here, which is just essentially means below the stomach, below the digestive system. Okay. And that is all that we are covering for today. So definitely go in and answer the questions in the Google form, and then look out for the video tomorrow.